I haven't recorded any.
I'm Darren McNutt, and this is Dr. De Silva. Dr. De Silva, I'd like to thank you for agreeing to do this video.
My pleasure. You're welcome there.
To start, can you tell me how your job improves our community?
Well, as you know, Darren, I'm a physician. I take care of patients, and I have been in this community for about 10 years. This year we're celebrating 10 years of being here, and we've been very thankful for this community because it took us in. We came from another community. We're not originally from Alabama, and we have been giving care to patients. I take care of patients with cancer and patients with blood diseases. And I believe that by taking care of people in this community is a way to do something good for the community.
How do you know when you've helped someone?
Well, first of all, if you're going to do anything in your life, professionally or not, you try to do a good job, and you have to do it with your heart. If I can give any advice for any young people looking for a profession to follow or something to do to support their families during their lifetimes, to do something they like, to do something they really enjoy, and they have to do it with their heart. And when you do something with your heart, you just communicate with other people's heart. It's a heart-to-heart thing. When people come to my office for me to take care of them, they come to look for help, and I sincerely, in a Christian way also, I try to give to them what they're looking for the best way I can. And when I start seeing results from that, sometimes I help them just by talking to them. The first time they come in and I talk to them and they talk to me and we establish a relationship and we understand each other and I can explain the problem to them in a way that they understand. And I deal with cancer, so explaining sometimes to a patient who has a new cancer what he has or what she has, and what's the way that cancer behaves, and what happens if you do nothing, and how can you change the natural course of that disease. Just by talking to people, you're helping them. Then when you put them through a plan or to a treatment plan, certainly by getting the results that the tumors melts or go away, people will feel that help is enhanced. More than anything is make them to feel comfortable, make them to feel close to a normal life is the main thing. And people is so thankful to you. And at the same time, I'm so thankful to them because we make each other to feel good. I used to tell everybody that I have a lot of fun in my job at the same time I practice. And one thing is because I truly enjoy what I'm doing with these people that are my patients, that are kind of a family to me. And I think it's a way we perceive on each other when the help comes. And I think I perceive on their eyes and on their whole being when they're getting help and at that moment they are thankful inside. They don't even need to say. We get so close to each other, our relationship becomes so intimate in the office by being friends and having to deal with these problems that are such, so private to somebody that you get to be good friends, you get to know each other. And so it's easy for us to read in each other's eyes what's going on. And I think I learn when I'm helping them.
Mm-hmm. Can you always cure cancer?
Well, the answer to that is no. Today we have about 1 out of 3 cancers are curable. Did you know that? When I was your age, there was no such a thing. When I was in your age, either cancer was cured at surgery or there was no way to cure cancer. Today we cure cancer by using a combination of surgery or radiation therapy, that is treatment with x-rays, chemotherapy, that's treatment using shots or medicines that travel throughout your body, and other things, that's bone marrow transplantation, genetic therapy, there are gene therapy, there is monoclonal antibodies and alpha interferons and other drugs, biological modifiers. There's so many things that we use to work on cancer. And by using different modalities, we're able to cure about 30% or 1 out of 3. 50% of people is alive 5 years later. And the main thing is to offer everybody some sort of help and support and try to make them feel close to normal as possible. Yeah.
How can you help them if you can't get them well?
Well, I think I always can help my patients, or I can help the vast majority of them. You have to understand that get them well does not mean necessarily to get them cured with cancer. Sometimes to cure cancer, you put the patient through a lot of suffering. For example, if you have somebody with acute leukemia, which is a curable disease, did you know that about 90% of children with acute leukemia of certain type, the so-called ALL, is the most common type of acute leukemia in children. 80 to 90% of children are cured. But for them to be cured, you need to give them chemotherapy that puts them through a rough time sometimes, long days in the hospital, receiving medicines and being treated by doctors and nurses. And so there's some suffering to that. But at the end, they are free of disease. Next year they're back to school and everything turns to be fine. And these children never have leukemia again. So it's pretty wonderful. And that's one way to make them well. Another way to make people well is they are feeling they are suffering because of a cancer, and you cannot cure that cancer, but you can hold it back, like we say. We give a treatment to prolong these people's life and to control the symptoms of the tumor. And that's one way to help them to get well. And they get well for some time. And that's important because when they came the first time to see you, they are feeling pretty miserable. Then they can feel pretty thankful for you to give more time and relief. And another way to get people to feel well is, say, you cannot prolong people's life, or you have a tumor that you cannot cure at all. And this happens sometimes. You've seen that. You heard of people like that, I'm sure, in people that you know in your family or people that are friends of yours. So some people have cancers that are not yet curable. And these patients come to me, and I help them to feel more comfortable. They have pain, and I relieve their pain. Or they cannot eat, and I give them some medicine and make them eat. They cannot sleep, and I give them medicines to make them to sleep. They are nauseated, I give medicine for nausea. And I make plans with nurses to come and visit them at home, and to provide them with a bed and things to make their life easier. Sometimes physical therapy to recover them. Pretty wonderful things that you can do for people, and you cannot imagine how thankful people is at that point in their lives to have that kind of help. Having that kind of help sometimes helps them to see friends that they have not seen in a long time, see family they want to see, do things that are important for them to do, sometimes writing papers along with their lawyers or getting some quality time with their children that come from far away to visit, this sort of thing. So you always can help. You always can help.
Decide you wanted to do this?
I think I decided that I wanted to be a cancer specialist when I finished my medical school. At that time, I knew that I wanted to do what we call internal medicine. So I thought I was best at the non-surgical areas, and I love to treat sick people. I felt that I like to treat diseases that would take more study and things, and I decided to do internal medicine, which is like internal medicine, like an adult medicine. You do cardiology, that's heart, taking care of the heart, and lung, which is pulmonary, and renal, which is kidneys, and so forth. In internal medicine, you take care of everything. You promote health, you do vaccine, and this kind of stuff. That's the basics. You go 3 years for that kind of training after the medical school. And I've done that. I did my internal medicine training. And during internal medicine, I got exposure to different specialties. I got exposure to every one of them, to neurology, that is brain and nerves, and cardiology, like I said. And when I got into cancer, I saw that cancer patients was quite sweet. They're very sweet people. It's kind of hard for you to understand, but it's a special thing taking care of our cancer patients. It's like a nurse telling you that it's nice for her taking care of babies when they are newborns. You know, they're sweet. And I think that cancer patients are very sweet. I love what I do. So, I wanted to be involved with patients and families, and you know something. I think it's the area of medicine that is more explosive. It's the area that you have more discoveries. You open the medical journals, and there is something new being discovered, and something new being cured, or a new drug being offered, and a new scientific thing coming up all the time. And that's very exciting, and I want to be part of it. So I decided that around that time, when I was doing my internal medicine program after medical school, my residency, I decided I want to go into oncology. And I did hematology, which is blood diseases, and oncology together. And that's what we call hematology for blood diseases and oncology for cancer. So that's what I do.
If you had it to do over again, would you still do oncology?
Yes. Oh, yes. Now that I have been through, I love being a physician. I thought of being a physician since I was a small boy with my grandpa. My grandpa was a pediatrician, and I loved to sit by him and ask his stories of medicine in the old days, and he used to tell me. And then I was a Boy Scout, and I was a nurse for the Boy Scouts. And so since an early age, I wanted to be a physician. It's not easy to be a physician. Everybody has a complaint to make. If you talk to people in the hospitals, everybody says that something is going on that makes my profession difficult. But that's like that everywhere. I am very blessed because I think I have been successful in what I do, and I'm so happy inside. You know, every day when I come home, I feel that I've done something to help somebody, to make me feel good, and to make that person to feel good. And I feel very, very rewarded. So if I would have to go back, yes, I would have gone to medical school again. I would have chosen oncology again. And I think I would have come here to this area of the world where I'm very happy and I've chosen this as home. So I don't regret anything I have done.
What effect does the work you do have on your life?
Oh yeah, that's a great question. You know, sometimes I get, as I said, sometimes I get rewarded with what I do, and I felt that I helped somebody, and I get to be very happy. But sometimes, you know, some of my patients get sick, or I try to do something to help them, it just doesn't work, and it makes me sad. Sometimes I'm trying to help somebody, and something is not working. I feel nervous, so I have different feelings crossing this, and I bring them home, and my family shares them with me, and I never mention to my family about who is the patient or whatever, but sometimes I tell them that I have a patient with such a problem, and I share with them that some of my feelings, and so this affects everyone in my home, but overall I have a pretty happy family. So I have this need to feel life. You know, I have this need to go out there and experience life, and so I love to go out with my kids and see them growing, and go on a trip with them, go on a trip sometimes just with my wife, or go out with friends for dinner, or meeting people at church that I care for, go out dancing, we love to dance, you know, and things like that makes me to feel alive. Reading a good book, going into the internet, things that I like to do. I like to practice sports. So, and when I have this life coming to me, I'm able to go back to my office and give some of this life, of this passion that I have for life back to my patients who need so much life. And I think I better be that way than being just a quiet, sad, depressed doctor. That would be no good for them. So I think it's important for them to feel some life out of their doctor and their nurses. I think my whole staff is like that. We're just, I think we have plenty of life to share with our patients.
Is there anything else you'd like to say about your profession?
Well, I think we talked about a lot. are just growing now and you're just at school age and you look what you want to do. And I think you need to find out that you need to do something that you like and something that's gonna, like you said, how does that affect your life? For example, if you like to travel a lot, you need to get a profession that allows you to travel. But at the same time, if you want to be with your family all the time, maybe a traveling job is not the best job. So you need to kind of put those things together. This can be complicated for people at your age, but we need to start thinking, what kind of profession do I like to do, and what kind of life that profession is going to give to me. When I choose medicine, I did not think about all these details, but I think it's important. Of course, studying and getting good grades and being good people and having your goals is clear and straight in your mind is a very, very good beginning. So I think this area has very good schools and very good orientation for goals, and I'm very glad to see my kids involved with the community and with the school system, and getting to know you and see that you are in the same way. And I really wish you all very good luck on your choices.
Thank you, Dr. De Silva.
You are welcome, Darren, anytime.
You go. Yeah. That's still in the video.
Okay.
That's great.